Well, hello, Kalamazoo. Hello. As you all know, this is Stephanie Moore. I'm coming to you live from two locations. One, my own personal social media page, but also Mothers of Hope. Today, we are representing Mothers of Hope. We want to take a little bit of time to talk to all of you about the vaccine clinic that's coming up. I want to just share with a few of you as you come in. Come on in the room. I see a few of y'all are joining and connecting. Hey, happy Thursday. I want to just let you know that this is an amazing opportunity for people in our community. So I want to make sure that everybody understands what's happening this weekend, Saturday and Sunday, and that we can get folks in. Before I jump too far into this, I want to give an opportunity to introduce you to an amazing individual I've had the opportunity to meet. His name is Aaron, and he's the owner of Advanced Health Pharmacy. Just a super, and what the young folks say, dope gentleman here in the community, doing excellent work, and has really, made strides through the state to offer some vaccines in the urban community. So, Aaron, I wanted you to introduce yourself, your staff, and we're going to just jump right on into this.
Well, welcome everyone. Here we are on a Thursday evening. We are trying to connect with everybody, all our neighbors in Kalamazoo County. And here I have Joe with me, my clinical pharmacist and wonderful pharmacist. What we are trying to do is vaccinate as many people as we can. So we are having this clinic. We tried our best. We've been trying for a long time to get our hands on the vaccine. And finally, this Monday, we found that we were the lucky recipient of state's vaccine grant. With that, we got the vaccine, and here we are. We are ready. Whenever you come over there, you should be ready with your arms out, and we'll get you out in and out in a minute.
I want to introduce to some folks also Dr. Cheryl Dixon. She's over at Western Michigan University School of Medicine. Dr. Dixon, your students were very instrumental in making the connections, the community connection to the pharmacy. The pharmacy was already on the road to the state to procure these vaccines. Talk a little bit about your students, how important this is that all of us engage in this work.
So actually, I think that's why we exist, right? Medical school exists to actually serve the community. So basically the students are very community minded. They're very, I think, culturally humble. They actually get it. They are here to actually make a difference. They want to make a difference. They volunteer for lots of things. So there's lots of initiatives that the students are involved in. It's no surprise that this one, Ryan DeMello, who's a fourth-year student, who is probably, I always talk to Mr. Marone, his uncle, about, he's actually very community-minded since day one. And so he actually helped to mobilize to get the student groups together. And he knows that that's what I do, is really community connections. And I've worked a lot, that's what I do. I work with the students on community organizations and projects, and so yeah, this is something that's important to the community. It's really important that we talk about vaccines. We talk about getting the knowledge out about what is the truth about the vaccines. What kinds of things people need to understand so that they can make informed choices. And then once people have made the choice to get the vaccine, it's important that the vaccine is something that's accessible. And that means you have to have it accessible to areas where really, people that need the service can get it. So we're excited about having the opportunity that this presents to actually be bringing the vaccine availability, accessibility to people who really need it.
Absolutely. And so Aaron, let's talk a little bit about your intentions of, applying for this vaccine and what should people expect on this weekend in terms of getting the Moderna vaccine.
Well, first off, the inspiration for this vaccine is Joe here. He's been after me for last 2.5 months. He's been telling me, why can't we get the vaccine? A little bit about us. We started doing COVID testing in June, and ever since we've been doing COVID testing right here in the pharmacy. And so we were trying to get our hands on vaccine. And what is going to happen is on the day when you come on for the vaccine, please go online and register first, because the more information we have, the less paperwork you'll have to do once you get there. If you can't, then it's still, we would help you when you get there to do a little paperwork. Bring some kind of ID with you. If you have an insurance card, if you have a driver's license, you have a state ID, please bring that in. Whether you have insurance or whether you don't have insurance, that has nothing to do with your getting the vaccine. Everybody is going to get the vaccine. When you come in, there is a slight amount of paperwork, and you would be. We have Western medical students talking to you about what to expect after you get the vaccine. And we would have about 3 to 5 vaccinators, people who would be giving you injections. So one thing I would suggest, that everybody please wear short sleeve shirts, because it will be much easier if you're wearing a short sleeve shirt. I don't want to do it. I'm going to do this. I'm going to take it out of my hand from the top, and then you can't get to the right spot. So that would be the best thing. Second thing is, you're not going to feel anything at that time. Maybe where we inject you, you might feel the poke of a needle, which is common with any vaccine. And when you go home, you might not feel the best, because anytime you are taking a vaccine, there is a chance that you might have slight tiredness, but it usually is not. It's very difficult to say who's going to get that or not. Most people would have slight something, not feeling the best of the best, but still, this is a vaccine which is going to save lives. It is not to be taken lightly. So a little discomfort is nothing. But what we are going to do is, we are going to get you in and we are get you out. So this is uh, the process. You come in, you register, you fill out a little form, we make copy of your ID, and there you go. You'll be on your way.
Absolutely. So someone just asked a question, which vaccine is it? And what we're going to be administering, or what you're going to be administering, is going to be Moderna, right?
It's Moderna vaccine, and that was was one of the two first vaccines which came out, and it has been used in millions of people. And the best thing about that is, these vaccines, anybody who has gotten vaccine so far in the whole world, these people have not been hospitalized and they have not died of COVID. And so these are the two main things. I don't want to go to hospital and I don't want to die because of a bug. And as you know, we've had over 500,000 people who have died right here in the United States. So just one vaccine, one poke, one time, and then one poke in 4 weeks, and you are protected. So far, nobody's been hospitalized who has received this, and nobody has died. And so that is a great information to know.
So we got a very good question from Danny Sledge. He asks, who is eligible? Persons 50 and over only? Or are we going to be also expanding it to essential workers and caregivers? I do want to say that this is a community-based pilot program where we are reaching out specifically to people of color living in the inner city in urban communities. That is our target population. People know that with Mothers of Hope, we're not always inclusive. We're not always exclusive. We are inclusive. But Danny, we are also intentional about reaching out to Black, Hispanic, Indigenous people of color. So yes, 50 and over. If you are an essential worker working in a restaurant, in a grocery store, in a meat packing facility, if you are a caregiver, absolutely, we want you to sign up. I did post on the comment the links for anyone. If you are in these demographics, if you're interested in getting the vaccine, click that link. You will be able to register, put your information in, and pick the time and date, Saturday or Sunday, that you want to come in. That is the easiest, most efficient way to register. However, if you are someone and you're not all that good with doing online stuff, that's okay. Call us. Give us a call. We will help to get you registered and get you on your way. So make sure that you do that, and you can also text us if it's more easier for you to send us a text and you got questions. We're happy to answer those for you. Dr. Dixon, do you want to talk a little bit just about why is it important? We are reaching out to people of color. Why is it important that we make sure that they have access to this opportunity and vaccine?
So I think that it's no secret that the people that had the highest rates of death, as well as serious illness with the COVID virus, with the COVID-19 disease, the SARS, the virus is the SARS-CoV-2, were communities of color, particularly African Americans, Latinx and Hispanic, and Native Americans. So there are highest rates of infection, highest rates of, when you get infection, of serious morbidity, which means that complications, and highest rates of death. So it was devastating to our community, devastating. And it was crossing all, it was not younger people, but even, they say older population, 60, 65 and above, higher risk, but we actually were seeing high risk of disease, disability, really being sick, even in our younger adults, mature, like in 40s and 50s. So if there's something that can prevent that disease from happening, which is what immunizations do, what vaccines do, what they do is they help to build up immunity in our bodies for protection, so that if that virus comes near you, your body knows how to fight it, and you won't get really sick, and you won't get the disease where you will actually die. That's why it's like really important that we get it. Essential workers are our population. So the essential workers, again, more likely to actually get, being close quarters and to be able to get the infection. So if we can prevent it by building up protection in our body, which is what this vaccine does, you have to weigh the risk of the disease with the benefit of the vaccine, and any side effect that the vaccine has is super minor or, negligible is what we say, compared to if you actually get COVID.
Absolutely. So I want to welcome to this conversation Denise Crawford. Denise is the CEO of the Family Health Center here in Kalamazoo. I'm not going to shy away from it, Denise, and tell everybody that this is where you can get the best healthcare access and healthcare services in Kalamazoo County, is at any Family Health Center site. You have 5-star practitioners. It is amazing. So I was almost going to say, get your health care there and get your prescriptions filled at Advanced Health, but I'm going to give you all a choice between the Family Health Center pharmacy and Advanced Health. But welcome, Denise. You've been doing this work for quite some time, ever since COVID became real in all of our lives. You from doing testing, just like Advanced Health Pharmacy was doing testing, now doing the vaccines. What's happening here and why is it important for our community?
Absolutely. So thank you so much, Stephanie, and I'm honored to be here and truly lift up Advanced Health as well as Dr. Dixon, as we all are here together, really working to stomp out this virus. And so, as Dr. Dixon has already indicated, this virus is devastating, and particularly with Black and brown skin. We know that nationally it is disproportionately affecting members within our community. It's disproportionately affecting us as when we look at death rates, as well as positive rates affecting members within our community. And so we want to make sure that we're getting on top of this. And right now, the vaccine is the best method that we have. It's 100% effective at preventing death. And that's what's so important, regardless of the rates that we're seeing. And we absolutely want to stomp out the ability to impact the infection rates and the symptoms. But most importantly, we want to be able to impact the death rates. And as indicated, we want to stomp the deaths out for all individuals, and Family Health Center is here, as well as all the members on the panel, to make sure that we're able to impact deaths. But we truly see it as a problem when we know that individuals with Black and brown skin are dying at rates that are 2.5 and 2.3 times higher than other members within our community. And so when we break that down to the bare minimum, for every one Caucasian person that is dying nationally, that means 2.5 African Americans are dying. For every one Caucasian person that is dying across the nation, that means 2.3 Hispanic individuals are dying. And so we believe, as well as our president and others, that any death from this is too many. And when we have that disproportionate level, that is all the more too many. And so this virus has proven, and these vaccines have proven the ability to stop that. And that's what we want to do. We want to stop the death rates. And if we can do that with a virus that has proven to be safe, we're here to do all that we can to get it out to as many people and make it as effective and as efficient as possible. So we're glad to be a part of this and want to do what we can to save our community.
I just want to be able to stress to everyone the importance of this partnership. We had Aaron at Advanced Health Pharmacy, the owner, proprietor there, who had the inspiration to go to the state and to be able to access these thousands of doses, but also have, the mindset of knowing that it's best served it's greater served in the most vulnerable parts of the community. So I definitely, on behalf of Mothers of Hope and the neighborhood that I live in, I want to say thank you, Aaron, for having that intention on getting some access to our community. And I also want to, give that same praise to Denise and Cheryl, who have worked overtime, who continue to work overtime to get these vaccines, to make sure that we have testing, to make sure that we have access and health access as well. So this is extremely important. I think that partnerships like this is what keep our communities healthy and viable. We don't want just people to live, we want them to thrive. So Aaron, I want to give it back to you all and throw some more comments out there. And why are you doing what you're doing?
Well, it is so important that we have to lift all boats. Where there's accessibility, there is no need to do too much. But when there is not the accessibility, that's where we need to make slightly more effort. But that effort cannot come just by your own. If you were not there, Stephanie, if you were not there, Cheryl or Dr. Dixon, if you were not there, Denise Crawford, Dr. Crawford, if you were not there, we couldn't get to the people who need it the most. So this is a worldwide problem. It is not, cannot be solved by just vaccinating this neighborhood where this pharmacy is. We have to reach out and touch the people who can't come to you. You have to always go. The well has to sometime travel to the thirsty. And this is what, otherwise, when there are no resources or the resources are less, education is less, but the demand is the most. I see so many times that a lot of people, as we are getting all these positive people who become positive of COVID. But when I talk to them, they are telling us, "Oh, all I have is sniffles. All I have is cough. It's just like a little flu. There's nothing is happening." But I must tell you that this virus, although it might seem like it's only a flu, but the far-reaching consequences, if you have heart disease, if you have diabetes, if you have lung disease, then for long period of time after this flu passes over, this COVID, this virus goes out of your system, it stays with you and it can make you sicker and sicker. There has been so many reports that people who already had heart disease, their heart disease became worse, and we don't know how long that worst heart disease is going to last. So that's why we worked really hard, but without the help of Mothers of Hope, as well as Dr. Crawford and Dr. Dixon and Ryan DeMello and School of Medicine, Western School of Medicine students, without all these people and all the churches who opened their doors for us, all the community organization, Uplift Kalamazoo, and several other places who said, we would provide you effort, we will provide you with all the resources. And that's why we are here. And we are so thankful to the community and the community leaders like you all that we can come out and do our due diligence, which we are so inspired by what you guys have done, because we need to reach to the every last person who needs this.
Yeah.
And we would come to you. And please, please, please take this opportunity and tell your neighbors and tell your friends and let everybody know. Share this with on your Facebook so that we can reach. We don't want a single more death than it ever has to be.
Absolutely. I'll share with individuals, and many of you know that know me personally and follow me. I recently was impacted by COVID-19. I tested positive several weeks ago, and it was awful. So, I'm going to say that, and I'm be very real to everyone, that if you can avoid this disease at all costs, do it. Social distance. Wear your face mask, wash your hands. 20 seconds is nothing compared to the discomfort, the pain, what it makes you so hard to breathe, from having a fever, I lost my sense of taste. I lost my sense of smell. And Aaron is right. Even though I'm out of quarantine and I'm beginning to bounce back and heal, I have a lot of lingering things. I still deal with fatigue. I deal with some breathing issues. Matter of fact, I get shortness of breath often. So the best thing that you can do is protect yourself with adhering to all of the CDC guidelines the best that you can. You should also make sure that you are getting vaccinated when it's available, when you can, especially when you are vulnerable, extremely vulnerable. Dr. Dixon, I think I'm younger. I'm fairly healthy. And yet I went through a very tumultuous time surviving COVID, if you will. So I want to talk just briefly about that just a little bit, and just express to you all that this is why we're doing this with Mothers of Hope, because we love where we live, we love our residents, and we want to make sure that everybody has access to this opportunity. So I want to take just a minute and let folks know what to expect on both Saturday and Sunday. Denise Crawford came out with her expertise and all her grace and beauty and told us this is how we got to lay this thing out so everybody can get in, we can be efficient. effective. You get your vaccination and then you go. And so we are really set up, you all, for this coming weekend for a drive up opportunity. People will be able to come to Mothers of Hope. We are located at 603 Ada Street, right in the heart of the neighborhood in Kalamazoo. You would be able to come and drive up and stay in your vehicle the entire time. We will get you registered. We'll take care of all of the preliminary stuff, and then the clinicians, they will come right over and they will vaccinate you in your vehicle. You will stay in your vehicles because we will also be able to monitor you to make sure you don't have any type of reaction or adverse effect or anything from the vaccine. And then after that, you'll be able to drive right off. Now, for individuals who are not driving, you don't have transportation, or let's just say you live right there in the neighborhood, we will also have seating available for you. We will have big tents. It will be comfortable. You can come right in. You will sit down. We will ensure the social distancing and everything. If you don't have a mask, don't worry about it. Mothers of Hope will have plenty of masks for you, and we will take care of you. Once you get your vaccine administered by the Advanced Health Pharmacy folks, then we'll send you over to another tent where you'll be able to sit back and relax, wait your 15 to 20-minute observation time, and then again, you'll be able to go. And because Denise is who she is, y'all, she makes stuff happen. We will have the barbecue grill going all morning long. So when you pull up, it's going to be smelling good. We're going to have some food for you. We'll have some beverages for you. And of course, because we are who we are, Dr. Dixon, everybody's going to get some sweet chocolate as well. So we're going to have a very awesome experience. We're going to create a very safe and welcoming environment into our neighborhood so that they can get health access that they need. So I want you to know it's drive up. If you're not driving, you can walk up. And lastly, Denise, because we always do what we do, we will have the most incredible DJ Chuck with us most of the day on Saturday and Sunday, spinning live all the greatest music and hits. Our vibes will be so high in this vaccine clinic that everybody in Kalamazoo City, in the surrounding areas, are going to run over there and ask Advanced Health Pharmacy and Family Health Center folks, vaccinate me now. So we're looking forward to everybody being on board. Any last comments or suggestions? Somebody did ask a question. I don't want to miss over that. They asked Dr. Dixon about underlying issues. If you have underlying health issues, Avanette Morris was saying if you got rheumatoid arthritis, chronic kidney disease, are these folks candidates for the vaccine?
So usually if you have a chronic disease, it is important to ask your doctor, particularly for the kidney disease, because I'm not sure if she's on dialysis or not. But arthritis, sure, you actually can get the vaccine. And people with most chronic diseases like asthma, and there's like a list of chronic diseases, high blood pressure, you can get the vaccine safely. There are some precautions, like if you're a transplant recipient, you may want to check with your doctor first. And even in those cases, I believe they are recommending the vaccine. But I just think that not knowing more about the kidney disease problem, I would definitely check with your doctor first. But the vaccine has been proven to be safe to give to most people with most chronic diseases.
Awesome. Denise, anything you want to throw in there?
No, I think you covered it all. Again, we will be there waiting for them, obviously doing it all in a very social distance and appropriate manner, but we are there to take care of them and ensure that our community remains safe, healthy, and viable.
Aaron, can you just talk a little bit to folks about your pharmacy, where you're located? How can people access your services?
Sure. So we are located in Portage at Oakland and Center. I'm been a pharmacist in this area for the last 30 years. And we have patients we deliver to where we are vaccinating. And once we get down with this clinic, I'm going to definitely get after Dr. Crawford and partner up with her so that we can expand that coverage. We can help more people. And it's all about collaboration.
It is.
You know, my mother taught me one thing, and that was she said is that she's still with us, and she said this whole world is a big huge family, and we can't let just the lack of resources so that we can't help those people. So please, we are out here in Portage, but we are still your neighbors. We are still thinking about you. And that's why we are so eager to come out and vaccinate anybody and everybody who shows up there and who qualifies for this. And I was so happy to hear about the music and the food and the resources provided by Family Health Center and Dr. Crawford. And I don't want to embarrass Joe, but in his previous life he was a DJ. So if you guys, if your DJ wants to take a break, I got a DJ right here. And if you ask Ryan DeMello, he would tell you I'm called a party starter. So I might bring some Indian beats over there, and we might we might do some bhangra, which is a different kind of music. But we might do something else over there. So it wants to be a safe but fun and festive, but safe. But the safety is in getting that vaccine. So, Joe, what do you have to say about that?
One last thing about people who qualify, you know, the 50 to 59, they even say if you have, you know, lung condition, heart condition, blood pressure, even if you might struggle with weight and, you know, be obese or have overweight, even if you are a smoker, you know, those conditions are all people who qualify. So, you know, we want to make sure if you have any of those conditions and want to get vaccinated, you know, like we were saying, we want to be able to offer it to as many people as we can and help be able to vaccinate the community. So that is the goal.
We want to run out of vaccine as quickly as we can so we can get more and we can reach more people. So
Absolutely. Please. Absolutely. Well, we're going to have a good time. Aaron, we welcome all of the culture, all of the love into the heart of the neighborhood. This is what really empowering communities is all about, making sure we're working together, we're sharing our resources, our cultures and our views to make sure that we're taking care of each other. So we hope to see some more things that are happening. So absolutely, this coming Saturday, we start at 9 a.m. to 5 p.m. at Mothers of Hope. We're located at 603 Ada Street off of North Westnedge. And we will be there from 9 a.m. to 5 p.m. on Saturday and Sunday. How you get registered, the most easiest and efficient way is to click that link. I put it in the chat. We also have it all over our social media page. Go ahead and register, enter in all your information, and then you can also pick the date and time, as long as it's available, to come in for your registration, come in for your vaccination. We will have food, some treats. We have trusted practitioners that will be there. Everything that you need to have the greatest experience will happen this coming Saturday and Sunday. Denise, I know that Family Health Center has some upcoming vaccine clinics as well too. If you want to talk about some of your future or your ongoing activities, go right ahead.
Absolutely. So thank you, Stephanie. We actually have one this Friday at Stone's Church, and we'll be there from 11:30 to 6, and then we'll start continuing regular vaccine events. So you can look at our Facebook page, and we'll continue to update you. We'll start having them twice a week. And also we'll be reaching out to all throughout the community. So fortunately, we have been informed we'll start to get regular vaccine. And so we'll start to go all throughout the community to the rural areas and then also to our urban partners, just to, again, to make sure everyone is vaccinated and we are in this together. So stay tuned.
Absolutely. Before we take off, the Moderna. Did we touch on the Moderna and the qualities of it? Cheryl or Aaron, anybody want to?
I think from my standpoint, the most important component that I want to remind people of is that the Moderna is a 2-dose vaccine.
Right.
So as you receive it on Saturday or Sunday, we will see you in 28 days. So we will be right back at 603 ADA in 28 days. And it's very important that you come back and see us in 28 days. We'll be giving you that second date for that second dose. And please, please, please come back. We'll feed you again, but you come back and get that second dose so you are totally protected.
Awesome. Anybody else?
So most of the side effects are minor from that first shot. You know, just some muscle tenderness. Sometimes some people feel a little fatigue, but usually the side effects are very minimal from that first vaccine. They don't recommend that you take any Motrin or anything like that before you take the vaccine. So not to take any like Motrin, ibuprofen, or Tylenol before taking the vaccine. You can take it after, but not before.
Awesome. So then we're all set then. We literally are going to have a vaccine party. We will see you all. Please take the time to make sure that you schedule your time to come in and get your vaccinations. If you can't get on the link, feel free to give us a call. We will be here for everyone. We're going to do everything that we can to make sure we get everybody vaccinated. And if you can't get in this Saturday or Sunday, again, Family Health Center has, ongoing vaccine events that we will make sure that we will help you get the information and help you get there. I don't want to end, Dr. Dixon, without talking about a lot of the human power we're going to see this weekend. We're going to have students from the School of Medicine that are going to be out in the community sharing and helping and working with folks. I want to thank you for making that happen with your students, but talk about kind of how, empowered they are and how they feel so connected to community and being able to do this work.
I think, I'm really proud of our school and our students, because our students are very community minded. They actually, anything that comes up that where they can actually serve, they've got the heart of service. As I can say, Ryan, who actually is the student who kind of like helped to initiate this, and Gina Bravada, who's currently now a resident from Kalamazoo, went to Kalamazoo College, graduated from our school, and now doing residency in OBGYN and still doing stuff in the community for the community. It actually is, it is heartening for me as a practitioner all these years to know that generation is like that. Because that's what we need to start seeing the changes we need to see in health outcomes and disparities. Every year, every 10 years, they come out with the healthy people, things that they say that we should be achieving. And every 10 years, it has the same thing on there, eliminate health disparities. So we have not gotten there yet. I do believe that we will get there. And the way that we'll get there is to have students committed to doing this kind of service and partnerships to make a difference and make sure that there's equity with what we do for medical care and taking care of people who really have been at the lower level for getting the equitable service. So I'm very proud of them. I have hope in this generation that that there will be in the 10 years that we will start seeing health disparities won't be on there as eliminate health disparities, because that's what it takes. It takes that kind of commitment, and it takes that kind of understanding, and it takes that, cultural humility and anti-racism.
So again, Advanced Health Pharmacy, thank you for being the catalyst of making this happen, particularly on the north side in the urban core, Kalamazoo. Thank you to Denise over at Family Health Center. Her staff is going to be there in full effect. Thank you to Dr. Cheryl Dixon over at Western Michigan University School of Medicine. and to all of our partnering agencies. Aaron, you know, going to the state, this has been a partnership with several community-based organizations. So we're looking at being over in the Edison neighborhood with El Concilio. We're looking at being over on the east side at various locations. We will roll all of this information out so that we can get everybody access and opportunity, but more important, vaccinated. So again, Advanced Health Pharmacy, you put us on the map, on the road of continuing this work. Thank you to Family Health Center for, you were the first one on the ground, especially on the north side, doing testing and even vaccination, Denise. So thank you. You are our hero. Together, my grandmother always says, teamwork makes the dream work. And so here we are. We got food, music, culture, and vaccines. We will see you all beginning Saturday morning at 9 a.m. at Mothers of Hope, 603 Ada. Thank you all for tuning in. Thank you for joining our live.
Thank you.
And we shall see you all this weekend.
Thank you.
Bye-bye.
Thank you.
Bye now.
Bye-bye.